Heart surgery in the past has meant a minimal survival rate, but with the new techniques and procedures, this has dramatically changed. Laura Windsor gives us this report.
The advances in cardiac surgery has evolved in the last 30 years to make this surgery commonplace. Surgeons are performing heart surgery with the latest methods and techniques that have taken decades to perfect. We spoke with Dr. Stephen Gundry, a cardiovascular thoracic surgeon at Desert Regional Medical Center in Palm Springs, to bring us the latest developments.
Heart surgery really got its start in the mid-1950s, and it really wasn't until the late 60s and early 70s where heart surgery became fairly routine. But if I had told you you needed an aortic valve replacement, for instance, back in the 1970s, I'd probably quote you a risk of dying of 20 to 25%, whereas now I would quote you a risk of dying of about 1 to 2%. So a lot of what has happened in the last 20 or 30 years has been figuring out how the body responds to heart surgery and taking the appropriate steps to get people through what was once a fairly dangerous operation, but now becomes a fairly routine and safe operation. And now, because we've got the safety factor down fairly pat, we're saying, well, why not do this operation through a very small incision or through no incision at all with just a few little pokes in your side and accomplish the same thing. We can now concentrate on making it more comfortable, making it more cosmetically effective, and kind of joining our colleagues in other surgical disciplines in working through scopes and even using robots to help us do this. Unfortunately, even though we know all the things that cause heart disease, we're actually seeing an increase in heart disease, both our cardiology colleagues and ourselves. And it may be that we're able to blunt some of the effects of heart disease. For instance, not as many people die from a heart attack as they did, say, 20 years ago, but they still have heart attacks, and they still actually have many heart attacks, but we're able, through technology, to get people to survive those heart attacks. So we've actually seen a whole new class of patients develop who have survived heart attacks or multiple heart attacks and have had stents or other procedures done by cardiologists. But now they have congestive heart failure because a lot of their heart is dead or not working. And it's a huge new class of patients. Over 500,000 people a year die of congestive heart failure. And it's kind of, those people are kind of replacing the people who used to die of heart attacks. We're just kind of prolonging the process longer. Right now, we're getting very good at doing single vessel bypasses using robotic assistant to help us. We now have actually several methods through very tiny incisions to give a person about an 80% chance of getting rid of atrial fibrillation with an operation. So I think you're going to see heart surgeons doing more and more things through very tiny incisions and actually helping people in that respect. The other thing you are going to see in 5 years is there will be fairly standard ways of putting most people with severe congestive heart failure on a left ventricular assist device that's implanted, an artificial heart that's implanted inside of them, that they wear a couple of video camera batteries on their belt, and they walk around and have a great life. We now have approval for one such device for people to go home with, and there's several other on the horizon that will certainly be here within 5 years. So you'll see heart surgeons doing a lot of changing out an old heart and putting in a mechanical one. So we'll give you an engine change.